Hi, it's Dr. Robert Brueck coming to you again with a continuation of our series on basic cosmetic procedures. I'd like to spend the next several minutes talking about liposuction. This is a technique that has been extremely popular for decades. It was really developed by a Frenchman, Toulouse, back I believe in the 80s. And it's a great procedure. And what liposuction is the removal of unwanted fat. Now, a few general comments about liposuction. It's important to understand that liposuction is not a weight loss program. You know, many times people will come in, they're 280 pounds, and they think I can just turn on the machine and just remove all the fat. You can't do that. If somebody has a significant degree of obesity, I think it's more important to go to a bariatric surgeon, see them, lose the 50, 60, 80, 100 pounds, then come back to the plastic surgeon to go ahead and correct the problems that have arisen as a result of excess weight. So liposuction is not a substitute for exercise, dieting, and weight loss. Now, many times people come in and they have what we call areas or pockets of fat that are resistant to diet or exercise. One of my favorite stories to tell is a young girl. She lives in Pine Island. Was very healthy. She jogged every day, did organic vegetable gardening and things of that sort. But she was like 90, 95 pounds dripping wet. But she had little saddlebags. And she said, Dr. Brueck, no matter how much I run, no matter how many sit-ups I do or anything I do, I can't get rid of it. We did some liposuction. We removed about 75 cc's from each hip. Her saddlebags were gone. Her shape was restored to where she wanted it to be. So liposuction is geared sometimes to take care of pockets of fat that just are resistant to diet and exercise. And many times I tell people it's genetic. How many times do I hear people come in and say, well, you know, my grandmother had saddlebags, my mom had saddlebags, I've got saddlebags, my sister has saddlebags. So those are your genes. You can't correct them. You can't get new genes. They are what they are. So liposuction is a nice way to go ahead and correct those abnormalities or unwanted deposits of fat. Now, pretty much any part of the body can be liposuction. Common areas on men include love handles, gynecomastia, male breast tissue. I did one this past week where it was primarily fatty tissue to the male breast. So liposuction can be used for a lot of different areas. The common areas on women, tummy and saddlebags or hips, big hips. Again, liposuction will remove unwanted fat. It will not, number one, tighten muscles in the abdomen. It will not take away loose skin. It is not a treatment per se for cellulite. Now, many times women come in, we suction their hips or saddlebag, and they have a lot of cellulite. So what I tell patients is liposuction may not improve your cellulite. It probably will be the same. It could be worse. Most of the time, it's the same. It could be slightly better. Because when I do liposuction, somebody's got a lot of cellulite. What I do is I take the thin cannula under the skin and try to break up those little septi, those scar bands that create the cellulite. It's not a guarantee. So it's important to understand I'm not getting liposuction to get rid of cellulite. I'm having liposuction to get rid of unwanted fatty deposits. It's important to understand that. It's a great procedure. We usually do it as an outpatient. And again, as I mentioned earlier, pretty much any part of the body can be liposuction. The procedure can take 45 minutes to an hour to 2.5, 3 hours, depending on what we're doing. Now, many times I will do what I call staged liposuction. Now, what do I mean by that? A woman will come in and she's fraught with frustration because she's tried every diet, she exercises, and she's just not able to lose the weight. But she's got a little more fat than we want. She doesn't want to have bariatric surgery, a gastric sleeve, or anything of that sort. So what I will do many times is I will suction, for example, the midsection, the inner thighs, let it heal, let all the swelling and the edema come and go, and then come back in 2, 3, 4 months and do a formal tummy tuck. So it's a combination. So we first do the liposuction, and then in that recovery phase, they'll diet, they'll exercise, lose another, hopefully 5, 10, 15 pounds. Then we do the tummy tuck. That's sort of the frosting on the cake. So it's important to understand what liposuction is. It's there to remove unwanted, unnecessary deposits of fat. It is not weight loss control. It doesn't tighten loose skin, and it doesn't tighten muscles. But it's a great adjunct in getting that body you want. So if you're interested in coming in for a complimentary consultation, feel free to call my office, 239 244-2329 or visit the website Beauty by Brueck.